And we're live. Good morning, everyone. Welcome to TeleShadowing. We're live streaming this session to YouTube. Please feel free to ask questions in the chat box as we go along, and they'll be addressed.
I'm honored to introduce our mentor for today, Dr. Ohuabunwa. Dr. Emmanuel Ohuabunwa is an assistant professor of emergency medicine at UT Southwestern Dallas. He completed his residency at Yale University, during which he served on the board of various organizations, including the African Research Academies for Women. In 2021, Dr. Ohuabunwa was named on the 40 Under 40 list by the New England Tri-State Urban Professionals Network. Dr. Ohuabunwa's area of interest is health, equity, and advocacy. Now, I'd like to request Dr. Ohuabunwa to begin today's session. Thank you.
Thank you so much for the fantastic introduction. Let me work on resharing my screen and we can get started. Portion of screen. Boom. Can everybody see my screen?
Yes.
Fantastic. Thanks so much, Omar, for the introduction. I am really excited to be speaking to you all today. The topic is my journey and battle with name-based microaggressions. So first we'll start with my journey and then we'll go from there. So I was born in Lagos, Nigeria. I lived in a relatively low-income area in Nigeria. My parents were pastors. They did a lot of work in the community, doing community engagement, and taught us the importance of finding a career and doing whatever you do with the focus of making sure that other people around you are better. They sent me to a military boarding school when I was younger. Although I hated it, I learned a lot, and that comes with the first lesson today, which is discipline, work ethic, time management. So the way the military boarding school worked was, we woke up every morning at like 5 a.m. We had morning chores. We had, after morning chores, we had to, get ready quickly, go for morning formations where they gave us announcements and stuff. And then we went to class, and then we had afternoon sessions, we had evening sessions. So your time was completely planned for you. And if you didn't follow that regimented schedule, you were in trouble. And, I think that was very important at a young age, because those lessons still continue today. And, where like I am very, very intense about time. I am very intense about, getting things done during the time that need to be done. And you stay disciplined even when you're tired and you're struggling to get up and you're struggling with motivation. And I encourage you all to find those experiences throughout your life that give you that opportunity to learn these skills. And the fact that you're actually here early in the morning, like Omar at 7 a.m. for him, shows that you already have those skills. So continue to cultivate that as you make that decision to go into the medical profession. We moved to the US when I was 13. This was a picture of our first Christmas, actually, in the United States, my siblings and I. And it was a very, very difficult transition moving here. For those of you who emigrated from a different country, you understand that experience of being bullied a lot. I was called so many different names. People called me African booty scratcher. They called me, so many different things. I remember one time I had a kid just literally as I was walking to the bus, just punch me in the face and say African and start running. And it took everything in me not to run and beat him up. But it brought that lesson back again for me was, no matter in what you do and the things you're trying to do, you're going to encounter a lot of adversity. Don't let that stop you from reaching your goals. I think back to that moment when that kid punched me, and if I ran over to beat him up and all that stuff, I'd be in trouble. I'd get a record. Maybe I'd have probably been arrested, and just that snowball effect that could have occurred. But thankfully, I'd stopped and didn't do anything. I cried because I was really, really sad at that moment. But look where I am today, and that wouldn't have been possible if I hadn't learned those skills of overcoming adversity as you keep going in your journey. So I went to, after middle school, I went to a high school for health professions. This is where I learned medicine, or I discovered medicine. So it was the Bakey High School for Health Professions in Houston, Texas. It was a very diverse class. And every summer we spent in the hospital. We're either doing volunteering, helping people with either bringing towels to patients, talking to patients, practicing history taking, learning medical terminology. And it was one of the best lessons, best times of my life, that high school period. I also met my two best friends during that time. And we were all from different, so one was Indian, the other one was Mexican origin. And so we just learned about each other's cultures, and it really helped buttress our experience. So the lesson from that was, one, to seek diversity, and two, to spend time in the hospital setting. I was talking to Amna and Omar, who were doing, trying to do work related to going into the hospital setting, like volunteering, whether it's shadowing, whether it's working as a tech in the ED, whether it's working as an EMS, whether it's working as a scribe. If you're interested in the medical profession, you have to get that exposure and do whatever you can to get that exposure into the medical field. And so happy to brainstorm ways for you to be involved in that. I went to Hopkins for undergrad. At Hopkins, I studied neuroscience and psychology. Graduated 3.98 GPA, was Phi Beta Kappa. I got a full ride scholarship to Hopkins, and I got into every medical school I applied to. So the question is, how did I do it? And so there are a few things. So one, for going from high school to college, I applied to a bunch of scholarships. It's pretty sad to say that there's a lot of scholarships that go unfilled. Unfortunately, because people see that one essay question and they're like, oh my gosh, I don't want to write an essay. And then they miss out on an opportunity when nobody else has applied. And if you had just written just the one essay, you would get like, $2,000, $3,000, or whatever it is. And so I encourage you to apply, especially for the high school students, even for college students going into medical school. Med school, I went to med school on a full ride scholarship. And part of it was applying to scholarships that are available, looking for things that you're eligible for, and really, really paying attention, because as you can imagine, undergrad for me at Hopkins was like $300,000 that I paid $0 for. And so it's a very, very important investment when you look out for what needs to be done in terms of scholarships and apply to them. Other things are, starting with a detailed plan. So if you going into undergrad, I had a plan. My plan was, okay, I want to graduate with a 4.0 GPA. Hopkins was known for for having, the grades were, there's the schools that are known for grade inflation. Hopkins was known for grade deflation. So I knew that it was probably going to be near impossible to graduate with a 4.0, but I had that goal in mind, and I had to figure out, how can I do that to make sure I got to put myself in the best possible position to get into medical school and all that stuff, So I started off with figuring out what my learning style was. I realized I love, when I listen to stuff, I remember it very well. I also, when I see pictures, I remember them very well. So I tried to convert most of my lectures into those formats where I would, instead of, I would have someone help me record the lectures from school. Thankfully, some of the classes you already had the recordings, and I would listen to them and type, and I found that I memorized everything by doing that. The other thing was finding study groups. It's hard to go through this stuff on your own. When you're going through difficulties of a rigorous curriculum in undergrad and medical school and all these different things, find a group of people who are like-minded, who want to do the same types of things as you, because then you will have these people who you can push while they also push you, especially when you're having difficult times. The other things was also talking to people who had an interest in medicine. And the reason for that was now I was able to learn different ideas. People would be like, hey, have you seen this research project that's available? A friend introduced me to this, research project, and a mentor who ended up writing me one of the best letters of recommendations ever, because I worked with her. She taught me a lot of things, and she saw my inquisitive nature. And I wouldn't have done that without that introduction. And therefore, starting with a detailed plan, figuring out your learning style, getting into study groups, and having some friends who are interested in medicine as you go. Other things that were important was extracurricular activities. I mentor a lot of students interested in medicine. And, one of the things they ask me is, what are the best extracurricular activities to do? And my answer to them is, find those things that are interesting to you, but also show your ability to communicate, to have compassion and interest in medicine. So I talk about various extracurricular activities I did. One of them that I really enjoyed, I am a huge basketball fan. I play basketball. I love it. I'm pretty good at it. And a group of us, we're part of this organization called Crossover Basketball, where we would go to inner city high schools in Maryland. So I went to Hopkins undergrad, so Baltimore, and we would play basketball with the students. And then after playing basketball, we would use that as an opportunity to then sit down with them and then talk about our paths towards undergrad, towards medicine, and all of that stuff. And you'll see how this was a way where you could connect with people, because you're coming from an area of, hey, let's play sports, let's do those fun things. Now let's show you all the different other things you can do. Aside from being a basketball star and aside from being a rapper or whatever, there's other things you can do. You can be a physician associate, you can be a nurse, you can be a physician, you can be an ultrasound technician. These are all things in the medical field that you can do that will pay your bills, that you'll be able to make a difference in people's lives. And you'd be surprised how many people didn't know about that. So that's very important. So find extracurricular activities that are very interesting to you, because also the other thing that people, that I advise is that you don't want to be seen as someone who does something for 3 months, goes to the next one, do it for 3 months, go to the next one, do it for 3 months. No, they want to see longevity. That you came into an organization, went on to be president, went on to be vice president, were involved in it, because that shows passion. That shows that you're not just doing this as a checkbox. The other thing, unfortunately, is scores. People care about your MCAT score. They care about your high school grades and all that stuff. And that's where, in the beginning, my last slide, having a detailed plan, having study groups, having people who motivate you is very important. The third thing is mentorship. So it's very, very important to seek out mentors early. And mentorship is not going in and saying, oh, you are going to tell me everything that needs to be done. Mentors are sometimes, there are people who I've considered mentors who I met maybe once a year. But part of it was I saw them as people who I wanted to model my career after. I saw them as people who had the work ethic that I wanted to learn to be like. And I just followed them. I'd follow them on social media. I would see the things they were doing. I would see their lectures. I would, go through those things. And so there's various forms of learning from someone that does not necessarily involve talking to them every day or every week or whatever, but just seeing what they're doing and getting ideas in order to be better at what you do. And then the last part for getting into medical school is the cohesive application. It's very, very important. Making sure that your application actually makes sense and it's not just like a hodgepodge of 20 million different things that you try to check box in order to be able to get into medical school. So that's kind of what I did. Thankfully, I was able to get into those, so I got into Harvard, Yale, Hopkins, all of them. Ended up getting a full ride to go to Yale. And while there, I did a combined MD MBA. And the other question I always get is, why the MBA? So MBA was very important to me because I was always interested in the financial aspect also of medicine and sustainability. And so I realized very quickly that when you're trying to get people to make changes, to do something different, one has to first think about the financial repercussions for it. Because I see that a lot of people have ideas. Oh, well, let's make sure that you can spend 30 minutes with each patient so that they feel welcome, they feel happy that you did stuff. The problem is, especially as an emergency physician, that's kind of not how the health system is set up. The goal is to see a lot of patients in order to be able to be efficient and all of that stuff. So knowing the financial constraints of stuff, how can we still make sure that every patient feels like they were well taken care of, and they got their questions answered? And that's kind of how the financial aspect of things in the MBA forces you to think. Is not just proposing solutions, but proposing solutions that are realistic based on the constraints of what you have available. The other thing the MBA helped me was in terms of community engagement and system leadership. You take a lot of classes related to leadership, various types of leadership, what works, how do you figure out your communication skills compared to the other person, and how can you align those two together? And then the fourth thing is personal finance. So all of those things really were lessons that I knew I wanted to get, and go into YALE, where the focus was business and society. So not just making money, but how can you use your platform to do good in society? And so being in an organization like that was really, really beneficial for me. I'm so grateful to have done it. So happy to talk more about choosing business, doing a combined MD MBA. There's other combined degrees. There's the MD MPH that people can do. There's the Masters of Health Science. There's people who do research curriculum. So this is not the only way, but this was the way I used, and I'm really grateful that I was able to do that. So after medical school and business school, I stayed at YALE to do emergency medicine. So it was a 4-year program. It was great learning and research. And I discovered my passion for health equity. Some of the things I did while at YALE, I did a lot of projects. Like when this was a community engagement project where we did a voter registration and health summit. We were able to get funding from the hospital system in order to help people register to vote, also help them. There was needle exchanges available for people. We gave flu shots. We talked about substance use disorders and things that people could do with that. So there was so many different things that we were able to accomplish with that. I do a lot of recruitment. So the pictures on the top, the middle, are related to SNMA. And then doing a lot of recruitment. I do a lot of podcasts. And then I got an award for all this community stuff from U.S. Congresswoman Sheila Jackson Lee, which was such a great time. But my time at YALE was so fantastic because I was able to learn more about health equity, advocacy, and administration, and was able to practice those skills. I decided to move to Texas to come back to be with family. This is my beautiful family, my siblings and my parents. And I was grateful to have come to UT Southwestern. And I came in the middle of the pandemic, so that was fantastic. And that was a different, time and a different struggle. But it was great to be on the front lines, taking care of people, and allaying fears that people might have had, especially as related to COVID-19. And it's been a fantastic time so far. So I could pause right now, Amna, and answer any questions, or I can keep going to the next phase, which is talking about microaggressions.
Yes. If anyone has any questions, you can put them in the chat, but I don't see any as of right now, so I guess you can keep going.
Fantastic. So the next part was talking about microaggressions. and kind of the area of my research now. So microaggressions are brief and commonplace indignities that communicate hostile, derogatory, or negative slights to target groups. Microaggressions, have multiple bases. They can be based on race. They can be based on sexual orientation. They can be based on gender. It's literally just about certain target groups and doing these indignities that make them feel like they're not part of the group, and communicate derogatory slights against them. Um, Microaggressions have many negative effects. So there's been negative effects related to the mental health of the people, physical health, including hypertension, obesity, and substance use disorder. And then bystander health is an interesting one where it's not just the person who experiences it, but it's also people who are watching and seeing that this is a hostile work environment. And they also have very negative effects associated with the microaggressions. And as you can imagine, that multiplies the effects of a microaggression against someone, and therefore becomes an important impetus of why we need to make changes to avoid this from having a multiplier effect. Oh, the slides are being annoying. Okay. So microaggressions have also been associated with burnout. So these are two studies looking at the prevalence and nature of microaggressions. So especially the first article was from JAMA and showed that there were higher odds of burnout in female and racial minorities who experience microaggressions. The second article looked at URI underrepresented in medicine respondents, and they were more likely to feel microaggressions and feeling of burnout associated with it. So this is bad. And then, as you can imagine, burnout has been associated with turnover. This was a study looking at that, and this was actually some of my colleagues at YALE showing high rates of turnover among people who experience these microaggressions. And then turnover is very expensive. This was a study looking at that it can cost up to $500,000 to $1 million for that when a physician leaves organization, and this comes from both the loss of productivity that occurs, the amount of money it takes to recruiting people, the amount of money it takes to getting people up to speed, moving costs, and then the time and the loss of productivity when that new person comes, because they don't come in and immediately know what to do. They're learning the system, so they're slower at that time. And so these, as you can imagine, this is very expensive and becomes something that people need to really pay attention to in terms of making the system work for everyone. So I wrote this article in the Annals of Emergency Medicine titled "Say Our Names, We're Doctors Too." And in this, I highlight what is an area of microaggressions called name-based microaggressions. So this is a subset of microaggressions that captures discriminatory actions against those whose names do not conform to mainstream standards. One second. So in it, I talk about an experience where, I had just come in from come into the ED for a shift. I was a senior resident. It was my 4th year. And for those of you who have not been in the ED, how many people have shadowed in the ED? I actually want to see, raise your hands, do like the hands thing. If you've been shadowed in the ED. All right, so I see that 2 people raised their hands. Fantastic. How was your experience? Mina Hill, I think you raised your hand.
Yes, I would say it was a great learning experience for me. It was a community ER, so it was less busy, but it was a really impactful experience being able to communicate and participate and seeing my fellow community members in the ED there.
Yeah, what did you do? What was what did you get to see? What did you do?
So I actually had the chance to witness a couple of like stitches,
Okay.
extractions of like pus from some people's abscesses. And
Okay.
also what I would do is sometimes I would just deliver water to some patients or warmer blankets as I was shadowing in the ED.
That's fantastic. I remember doing that. What stage are you? Like, are you in high school, college? What are you doing?
I'm applying to medical school in May.
Fantastic. Yeah, I remember doing a lot of that when throughout my time. Like, shadowing is extremely important. So I'm glad that you did that. Someone else raised their hand. Who's that?
Yeah, me too.
What's your name?
I'm Leela.
Leela, nice to meet you. So what did you do while you were in the ED?
So I shadowed some physicians in Juneau, Alaska, where I'm from originally. So it was a
Mm.
much smaller ER.
Wait, in Alaska?
Yeah.
Wow, that's intense. Wow. Okay, good.
And I think I saw a lot of the same things that she just mentioned, some stitches, some burns, that kind of thing.
Okay. Did you get to do any fun procedures? You guys need to go to some busy ERs and like where like you see gunshot wounds and things, because yeah, that's where, because when people see the I don't know if you guys ever, I don't know if I feel old now. But there's this show called ER. That was, I think it was even before my time, and it seemed like every 5 seconds someone was coding and you were doing chest compressions and stuff like that. So that was my picture of the ER until I first shadowed. And then I saw that, oh, well, there's other things people do. We're not just always every 5 seconds, like doing chest compressions. But I think it's important. And then Layla, what stage are you?
I'm also applying in May or June.
Oh, fantastic. Well, good luck to y'all. And like, I hope you get into the best medical schools you can and have a wonderful time in there. So in the ED, so for Layla and Manihil, what's your name? Say that again. I'm just trying to think of the other person who
I
put
think it
her.
was Minahil.
Manahil.
Yeah.
Manahil. Yeah. So for Layla Manahil, like the senior resident walks in, and you guys shadowed in a smaller ER, so maybe that didn't happen. But I was in big academic center, Yale, and senior resident, and then there were two residents, junior residents, and then there's the attendant, and the attendant was like, "Hi, my name," and obviously I'm changing the names just to protect people's privacy. My name is Dr. Jones. And then she turns to the other junior residents, and these are Doctors Jonas and Jessica, Dr. Jonah and Dr. Jessica, and then turned to me and says, "This is Manny." And I gulped. I was like, okay, so I am no longer a doctor, I guess. And secondly, why did she call me by my first name? And then I thought about how throughout my experience in high school, in college, even throughout residency and medical school, I found that, especially during residency, it was always Dr. Jones and Manny. It was never Dr. Ohuabunwa. And the reason I realized was because people could not say my name. But before I found that out, I just felt a lot of imposter syndrome, because as you can imagine, when this stuff happens every time, it's always Dr. This and your first name. It just feels like, why am I not a doctor too? Am I not a doctor too? Are you trying to say that I'm not good enough? And it started affecting me in various ways where, like, I had anxiety and sleep problems. I felt like an imposter, even though I'd done really, really well throughout my life. I felt burnouts due to lack of recognition, because as you can imagine, when people with easy names or relatively not ethnically distinct names, people would say, "Oh my gosh, Dr. Jones is fantastic." But when it came to my turn, it would be like the whole team was fantastic because they didn't know your name. And the problem is then that these people who are making decisions about like awards and stuff go by, oh, well, someone said this person's name. So that person should get the award, not this other person, even though you were performing the same way that the other person was doing. So it was pretty difficult and had pretty poor experience, contributed to pretty poor experience during residency and all that stuff, and became something where I was like, okay, this, first of all, am I the only one that experiences this? And secondly, what can we do about it? So I then found out that name-based microaggressions occurs in society. So it occurs in, K through 12 experiences for classrooms and for students and job applications, especially racialized names in healthcare, where it affects the callbacks for mental health professionals, in the courtroom, where juror assumptions and case judgments were influenced by names. Name-based microaggressions, name bias can occur in recognition, where this was a funny anecdote of one of these places where they were picking raffle tickets to see who would win, a lot of money. And the person would pick one, look at the name, and like, I can't say this name, so drop it back and pick the other one until they got to a name where they could say, and then they said that. As you can imagine, those 3 or 4 people whose names they couldn't pronounce missed out on an opportunity to win a lot of money just because, no other reason, but because your name was different. And that becomes a problem. If someone doesn't see this as a problem, then we should be talking. So name bias does occur in recognition. Differential use of formality is something that I also talked about in this article, where speaker introductions, they showed that female faculty were less likely to be introduced by their professional titles compared to their counterpart male faculty. In all of these, though, the important thing to realize is that the intent does not equal impact, i.e., the people those colleagues who I worked with, who called everyone else doctor, but not me, were not trying to be spiteful to me. They just didn't know what to do with a name that they did not recognize and didn't necessarily care to learn it. So it brings us to a question I like to ask. So let's have everybody raise their hands if they are bad with names. So no one here is bad with names. Oh, okay. So I got a couple of people. So I've got Fabian, Layla. Oh, wow. Now there's a good amount of you guys. Okay, I got to pick on someone. Layla already answered questions before, so I'm going to stay away from Layla. Let's be nice to her. Manal. Who's Manal? Manal, introduce yourself.
Hi, good morning.
Hi.
Can you hear me?
Yes, I can. Did I say your name correctly?
Oh, yes, you're right.
Okay. What stage of life are you? What do you study?
Oh, I'm a college junior right now.
Fantastic. What do you study?
Human biology.
Oh my gosh, you guys and your biology majors. Oh. I'm kidding. That's fantastic. That's good. And where are you from?
From India.
Okay, fantastic. Okay, cool. So Manal is not good with names. Okay.
Yeah.
All right. So who's this, Manal? And you can phone a friend if you don't know.
No idea.
Oh my gosh. Okay, who knows who this is?
I'm very bad with knowing people.
Does anybody know who this is? You can just say it out. You don't have to raise your hand.
My friends in the session, she says she does not know who that is either.
It's Matthew McConaughey.
Oh, who said that?
Leela.
Leela. Okay, I should have picked on you. Manal. Manal doesn't know anybody. That's hilarious. Okay, good job. All right. Next. If you don't know Manal, if you don't know who this is, this next person is, I'm gonna come fight you wherever you are.
No, oh my God, I know him. My dad watches him. Wait, I don't know his name.
Does someone want to help Manal because she's clearly struggling right now?
Arnold Schwarzenegger?
Oh, fantastic. Who's this? Who's that? Same person?
Amna?
I'm not fantastic. Okay. So the question for you guys, for you all is, how did you know their names? Like, how did you learn their name?
I watched a lot of his movies growing up.
Exactly. And you heard their names multiple times because, as you can imagine, Schwarzenegger, McConaughey are relatively difficult names, but somehow you learned them, right? And so for all those people who say they're bad with names, it's something to think about. Are you bad with certain names? And what is it about those names that you were able to learn, but you didn't learn other people's names? And one of the things that we find is that these people, the names, the reason you learned them is because you heard them. You heard them multiple times. And therefore, you watched the movies, you heard them on TV, on the news, and whatever else you were doing. And so you learned those names. And therefore, for you to learn other names, you got to hear them multiple times. And you got to ask, and you got to learn it. And so one of the articles, what I brought up was this model called Ask, Learn, Practice. So instead of ignoring a name, when you see a name that you don't recognize, it's quickly asking, like I was like, Manal, is that how I pronounce your name? You know, and Layla, you got to ask and be like, hey, how do you pronounce the name? You hear it, you say it twice. And just like Schwarzenegger and McConaughey, you can learn Ohuabunwa because you hear it, you ask, you learn it, and you practice it. Cool? So that's one. The second thing is email signatures. So this going back again to McConaughey and Schwarzenegger. So the thing is, you were able to hear their names and learn it because you've heard it so many times. But you know, some of us aren't movie stars. And so one of the ways that one could make sure that people can hear your name whenever it is in your email signatures, in your LinkedIn, you have a name badge. And the way it works is that you say your name in the microphone, and then it records it. And anytime someone clicks on your profile, it takes them to a site where now they can click on it and they hear Manny Ohuabunwa. So it says your name and you can hear it. And so for those people who need to, like, if you're going to be, having a meeting with me one day or whatever, you already have my name and you've heard it once, so that you're not going to be like, I can't pronounce your name. You're going to be like, oh, I've heard your name and I practiced it once and now it's Ohuabunwa. So those are two things I ask of you today, is that one, whenever you encounter a name, whether it's a first name, whether it's a middle name that is distinct, that you've never heard before, don't forget the ALP, ask, learn, practice. And the second thing is make sure to make a name coach email signature so that you will be able to listen to people's names, learn the names, and practice it so that you do not commit a name-based microaggression. Can I see a raise of hands if you can make that commitment today? That's fantastic. Thank you all for raising your hands. I'm usually used to like talking about these things in front of people. So we got to make do with what we got. So that's fantastic. Thank you all. And that's kind of all I have today. I am happy to answer whatever questions you might have about your journey, about my journey, about questions about medical school, about undergrad, or whatever. And please, Amna is going to send you a survey if you don't mind filling that out for me. All right, so while you guys fill out the survey, I see Layla ask, how did you decide on emergency medicine? Oh, that was actually, so I came in, so I studied neuroscience and psychology in undergrad. So my goal was to be a neurosurgeon. And then I got to medical school and, did my neurosurgery rotation, and I didn't like it. But when I got to the ED, I was excited. It was just so much fun being in there where, 1 second you have a heart attack, you're dealing with it, you have a cardiac arrest, you have a gunshot wound coming in, you just have so many things going on, and being able to task switch where you're going from one place to the next, and then you have an ankle sprain that you you talk to the person, you give a lot of precautions on what to do. So I just loved the variety that one encountered in the emergency room, and it made me really excited to be there. So as soon as I saw that and I realized that, I knew it was where I needed to be. And then I see that Essie said, could you please tell us a bit about how you maintain work-life balance, and in what ways do you make sure you're well for your patients? Oh, okay. Work-life balance. I feel like work-life balance is kind of a myth in certain ways because it's hard. I think it's one of the most difficult things to do because there's so many people, there's so much to do. But I think what you're trying to say is, how do you maintain sanity? And the way one does that, at least for me, I do the things I enjoy. So this is fun for me. So like talking to you guys, trying to work with people who are interested in medicine and recruiting, that's fun. Other things I enjoy doing, I love to exercise. I love to play basketball. So I make sure I make time for that. I'm Christian. I go to church. I make sure I'm working with a lot of people. Like I serve, in the ministry. I do a lot of different things that I think are fun and are making a difference. And there are days when I just shut off and decide I just want to watch Netflix and not do anything. And I think that's very, very important to have those times for yourself. So that you are able to recharge and be the best version of yourself. But it is, just to finish up your question, Essie, it is tough because there's so much to be done and so little time. But you got to make sure you fill your own cup, or else you wouldn't be able to fill other people's cups. So.
Hello, my name is Hamza. I'm a student in the BSDO program with Seton Hall University and the Lake Erie College of Osteopathic Medicine in Pennsylvania. And I'll be doing the rest of the Q&A session. So the first question I'd like to ask is, do you feel like you normally have enough time to counsel patients even during busy days in the ER?
So I think let's see the best way to answer that question, because having enough time, yes and no. So the ED is very busy. There's a lot of things that one needs to do. But it's not about quantity, but about the quality of time that is spent. So for me, one of the things I try to do as much as possible is delegation, where I make sure everybody on the team is doing something. If there's like something that needs to, for example, just checking in on a patient, I might ask the nurse, hey, do you mind go checking in on the patient to see how they're doing, while I run to go talk and counsel somebody else. And then I go to the next one. And my reason for doing that is that, first of all, I want to make sure that everybody is seen as part of the team. And secondly, I want to make sure that those tasks that someone else can do so that I can have a little bit more time to be able to focus on, counseling patients and things like that, I can get other people to please help me do it, because we're all part of the team in order to make for a well-oiled machine. But as your question does, intimate, there isn't a lot of time in the ED because it's very busy, but you got to make do with what you got, and you have to make sure that at the end of the day, the patient feels like they were heard. They have a grasp of what brought them in, and if they're being discharged, what they need to do next.
Thank you very much for that answer. The next question we have is, what is the difference between shock trauma centers and emergency medicine departments?
Shock trauma centers. So you're probably talking about the shock trauma center in Maryland. So I think it's one of the things is, so all of them see patients who come into the emergency department. Some trauma centers are more focused because they get a lot of transfers. So like, for example, one of the hospitals I work at is Parkland, which is is a level 1 trauma center, while the other hospital I work at is Clemens University Hospital, which is not a level 1 trauma center. So sometimes, so the designation is about, one, having a trauma surgeon on for 24 hours, having residents, having research related to trauma, having all the different specialties available for care, because, when someone comes in with a traumatic injury, they might have a brain bleed. Who's going to take care of that? You need a 24-hour neurosurgeon available. You need to have all these people in-house. And so that's kind of what a trauma center is when you have all the resources available for any trauma that comes into the emergency room. And there are some centers that do not. And in those centers that do not, they usually have an agreement. So like, for example, Clemens University, which is like literally 5 minutes away from Parkland, has an agreement. So when I work at Clemens, I'm calling some of my colleagues who I work with at Parkland and saying, hey, I have this patient with a brain bleed that I need to transfer. Or I have this patient with a complex fracture that can't be managed here that I need to transfer. And it's like an easy transfer to those other hospitals with larger capabilities.
Thank you very much for that answer as well. The third question we have is, what tips do you have for students who want to approach an ER doctor to shadow them in person?
So one of the difficulties right now is that because of the pandemic, at least at UT Southwestern, we had a moratorium on shadowing experiences, in-person shadowing experiences for obvious reasons. A lot of hospitals have like a shadowing program where people apply and it's streamlined. So I think that would be the first step, would be to apply to that program, so that, because they already have the system in place in order to get there, and then get into a shadowing. Other things, it's not just shadowing, like I talked about earlier. It's like, if you have a summer off, get a job get your EMT certification, and then start working as an emergency technician, or, be a scribe. These are the ways for you to also make money while learning about how the emergency room works.
All right, thank you for that answer. The next question we have is, how do you stay up to date on new research for novel treatments of COVID-19 and other cases you regularly see in the ER?
So there's multiple ways, like subscribing to journal feeds is one of the ways. So like, I have various journal feeds that I subscribe to, that they send me something every day, not just about COVID-19, but about the practice of emergency medicine. Constantly reading. So like, for me, anytime I encounter any pathology that maybe I'm not as comfortable with, I go do some more reading. Part of it is residency training. During residency, I made it a point to read the whole textbook. just to like really gain a lot of knowledge about things that I might not see a lot of. In Connecticut, for example, we see a lot of Lyme disease. Here in Texas, we almost never see Lyme disease. And so the problem, if someone who trained in Texas move into Connecticut for work, you might not be comfortable with Lyme disease because it's not something you ever saw while in Texas. So it becomes important to read the textbook and try to at least familiarize yourself. And if you don't, then read articles related to that. And then there's podcasts. There's a bunch of podcasts that I listen to that kind of help me keep up to date with what's going on in the field.
Great. Thank you very much. I think a lot of people here are minorities, so this question will relate to a lot of us. Since our population is becoming more diverse, do you believe that name-based microaggressions may decrease?
That's the goal. I think the goal is for that to happen, and the way we do it is by actually pushing for stuff, because I feel like sometimes we're like, no, just call me, like for some people it's like, oh, just call me Dr. O. No, if I recognize when someone's having difficulty, I'll be like, hey, Hamza or Mohammed, Ahmad, my last name is Ohuabunwa. You just got to learn it a few times, just say it a few times and learn it. And then it becomes a thing where people normalize saying people's names correctly.
All right, thank you very much for that answers. And here's another question about microaggressions. What are some other microaggressions beyond name-based microaggressions underrepresented minorities in medicine may face?
Oh yeah, so like in the, I think it was like my third slide on the microaggressions thing, I talked about, gender-based. That's a big one, where a lot of women, people think you're everything but a doctor. And that can be difficult for one to deal with, because it's like you're constantly having to prove yourself that you're the physician making the decision. It becomes difficult because patients might not really trust your knowledge of things. And so that's another big type of microaggression that people might experience. And for as an underrepresented minority is also like people. So I remember every time, when I would walk in, sometimes I would have people say, okay, well, the transport person is here or this. And I'm happen to be like, hey, no, I'm kind of your physician, here to tell you about things. And so it would be kind of difficult, but I think, it's also about advocacy. So now that more of us are coming into medicine, thankfully, people begin to normalize seeing people like us as the physician who's taking care of them, and as competent physicians who are taking care of them.
And thank you very much. And for our last question, what is the best way for resident teams to be more inclusive and culturally competent with their fellow clinicians and physician colleagues?
Well, that's a big question. What is the best way for resident teams?
I'll repeat it one more time. What is the best way for resident teams to be more inclusive and culturally competent with their fellow clinicians and physician colleagues?
So I think part of it is like education, right? So education because a lot of times people don't realize what other people are experiencing. As a male physician, it's hard for me until I, read a lot about and talked a lot to people who experience gender-based microaggressions. I didn't necessarily experience those things, right? As some people who are international medical grads, they have difficulties that non-international medical grads have. And you wouldn't know if you were not an IMG. And so the important thing is for everyone maintaining curiosity, asking people what their difficulties are, being open to learning about the difficulties other people experience, never being tired of being a good bystander. So when you're a bystander is you see something happening to someone else and you say, hey, by the way, I don't think this is right. Nicely, obviously, and saying, hey, I know you don't mean this, but you should when you call this person by their first name in front of patients, it can be difficult for them because they're already minority physicians. And so it's, or underrepresented minority physicians. And therefore, it's kind of important that they maintain that authority in front of their patients. And so I would like for you to, refer to them by their title, by the correct title, things like that as a bystander will be very, very important. But I think in terms of inclusion, constantly asking questions, maintaining curiosity, being open to being wrong, and open to feedback.
All right, thank you very much, Dr. Ohuabunwa. Those are all the questions we have for today.
Thank you so much, Mohammed. I really appreciate you guys taking the time to speak to me today.
Yes, thank you so much, Dr. Ohuabunwa. We really appreciate you taking the time to answer all of our questions, and this was a really interactive session for all of us. I'd love everyone to please give a warm thank you to Dr. Ohuabunwa in the chat box for this informative session, and don't forget to take his survey that I linked previously.
Thank you so much, you all. I really appreciate the time, and I hope you have a wonderful time. Rest of your day, the weekend, and good luck on your medical school applications. Okay?
Thank you so much. You too. Have a good day. Bye-bye. Now we're going to conduct our closing session with our quiz and future session dates. So the link to the quiz for this session is now live. And again, you will need a 70% or higher to pass and receive certification. That link is being sent in the chat now. So now on to our future session dates. And these dates are always posted on our social media outlets at TeleShadowing. And our next session will be next Saturday, April 9th at 10 a.m. Eastern Standard Time with our physician mentoring us in OBGYN. Thank you so much, everyone, for attending today's session, and we hope to see you in upcoming sessions as well. This concludes this week's shadowing session.